Hi everybody, this is Dr. Berardi, and we had some questions come through the practice again, and this one's about rhinoplasty or a nose job. So I'm sitting here in our pre-op area, and we just got done with a mommy makeover, and then followed by a breast augmentation. So no rhinoplasty today, but I figured I'd answer these questions. So rhinoplasty, where do the incisions go? So there's two ways of doing open and closed, right? Open is probably more typical in most practices, in which there's a tiny incision across this little bridge in the nose, right between your nostrils. We call that the columella. So we put a little chevron, which is almost like a angular incision across that. The human eye recognizes straight lines. It kind of overlooks irregular lines, so we make that line a little bit irregular. And the remainder of the incisions are within the nostrils, right? And this gives us exposure to the cartilage, gives us exposure to the bone. So the closed version, they don't put that incision across there, and they do everything through incisions in the nostrils. Now, for me, I don't get to visualize what I'm doing within the nose or visualize the structure, so I feel like I can be less precise with an open procedure, so I typically do, less precise with a closed procedure, so I typically do an open procedure. And this piggybacks on a question that we had with, do I have to break the nose during every rhinoplasty or every nose job? And the question, or the answer is no. So typically when we're breaking the nose, or we call it osteotomies is the medical term for it, it's when we're taking down, in most scenarios, a bump on the nose. So if you're looking at somebody, the nose is like a pyramid or a triangle where the point is directed toward you. So if we take down the bump, if you can imagine, it's taking the top off that pyramid, and then we look like we have a flat top pyramid. So that gives, the human eye picks that up, and it does not look normal, right? It almost looks like you have a very wide nose. So what we do to fix that is we have to take those, so we have our pyramid, and then we shave the top off, and that makes a flat top pyramid. So what we need to do, so if that pyramid has a flat top, we need to break the nose on the outside, or perform osteotomies on the outside, so we can tilt those bones back in to form a pyramid again. Other reasons, sometimes there's deviation of the nose that we have to fix. Sometimes people have had trauma in the past that we're fixing the bones that have healed into the wrong place, so we'll perform osteotomies, or we'll have to break the nose and so forth. So rhinoplasties, we covered open versus closed, or where's the incision, and then do we have to break the nose? Not all the time. So thanks for your time, and we'll get you next time. Bye.